Now, in other stories, we're looking at this one. Clinics and community-based anti-retroviral therapy clubs are ineffective in helping HIV-infected patients stick to their treatment. That's according to research by non-profit organization Witkoppen Health and Welfare Center here in Johannesburg. Their study revealed a 47% overall dropout rate from adherence groups. Well, for its part, the World Health Organization recommends these clubs, but up until now, it wasn't clear what impact these kind of groups had in terms of care. Well, to help us understand a little bit more about this research, we're joined in the studio by Lillian Mutunga. She's from the Center's Programs Manager. Lillian, good morning. Thank you very much for coming in.
Yeah, good morning.
I saw the press statement that you issued about this, and I was thinking one would have hoped such clubs are effective because they are closer to the community.
That's most certainly what we had hoped when we started the study. We've had adherence clubs conducted in other parts of the country and other parts of the world, and they had some pretty good reviews. So what we had actually wanted to do was have a comparison between the clinic-based clubs and the community-based clubs, just to see which one would be better in terms of patient retention in care and overall good health outcomes.
So because you got clinic-based and you got community-based, so you
That's
focused
correct.
on both, or you chose to look into the community-based ones?
We focused on both. So what we did is we randomized some patients into either a community-based or a facility-based club. And then we followed them up for 24 months and recorded the outcomes. So, and surprisingly for us, we found that retention in club care was not good at all. We lost almost 50% of the participants from club care. However, these participants were then returned to the clinic, where they actually reported and continued accessing care.
What were the reasons that you found or you could attribute to the fact that the community-based clubs are not effective?
I think it's still a mystery to us because, like you said, we thought that when the club is closer to the person, easier access, we'd get better outcomes, but we found that not to be the case. And at this particular point in time, we can only speculate. There could be because, in the clinic you're able to get other services as well. So I could be there to just pick up my drugs, but I'm able to pick up family planning. I'm able to, see the doctor for a headache or something, or any other thing. Then also, as much as we tried to make sure that these clubs were in friendly spaces, there was also still the issue of stigma, people asking why.
Yeah, I was just wondering about that
there.
because it's in the community, it's closer to where I live, and it's not really, I'm using an example, a clinic or kind of, because it's not official, maybe they'll talk about me. Maybe that kind of stigma is still worrying people in the communities.
That's most certainly something that we have considered because when these patients were asked to come back to the clinic, they continued with care. We're also considering the fact that, as much as this is something that we want to be able to enable the patient to access care, could be that, at times it just doesn't work. Life changes all the time. So something that works for me first 2, 3, 4 months might not work for me continuing.
So will you at the Witkoppen Health and Welfare Center try and delve into the reasoning? I'm asking this because globally, World Health Organization is saying this is an innovative model to use. Mm-hmm. But now you found in your 12-month study here that actually it is more effective to have clinic-based care rather than the community-based one. I think it would be important to find out the reasons, so perhaps you can assist in addressing them and fixing the problem if there is a problem.
We're definitely trying to do that. We have what we call a qualitative study where we are asking some of the people who dropped out of care in-depth questions. What was the reasons? What drove you to drop out? What could convince you to come back? And as soon as we have the outcome, we're going to share that as well.
Yeah. Now, the clinic-based one, in terms of what you think would be working besides being an official structure, you said when you interviewed them, and you remove them from community-based and you put them in the clinic-based, they carried on with the treatment as if there's no problem at all.
Correct. We had actually 80% retention.
80%?
So, yes, like I said, one of the things we're considering is that this life is dynamic and things change all the time. So in terms of ensuring that we support our patients, especially those who are in long-term treatment plans, we need to be able to give them options and have very candid and frank discussions with them about where you are right now, what works for you, what doesn't, and how we can support you best to stay on.
Is it the view of the Centre that the World Health Organization may be right, that the community-based care is innovative and that we shouldn't abandon it completely?
Yes, that's what I'm saying. I'm saying that we don't abandon it completely, but we have frank discussions about when does it work, how does it work, and how can we make it better. Because like I said, it could be that, well, I'm a housewife right now, and in the next 2-3 months I get a job, so I'm not able to come to the community, but I can go to a pharmacy somewhere and pick up my medication. So if we can continue having discussions about what works at what point of a patient's life, I think we can help them to stick to it.
When do you think your centre's qualitative research that you're busy with now, as you delve into the real reasons here, will be ready?
In the next couple of months or so, we should be able to...
It should be interesting to find out and talk to you again to see what it shows.
Most definitely.
I'm sure even the World Health Organization, which is advocating this as an innovative model, will be interested in seeing those results. Maybe we'll talk to you again in the near future.
No problem.
Thank you very much. That's Lillian Mutunga. She's the manager of programs at the Witkoppen Health and Welfare Center. A 12-month study that they've just done has revealed that the community-based anti-retroviral therapy clubs are ineffective compared to clinic-based ones, and they're continuing now with investigating qualitatively what is actually going on, because the World Health Organization recommends this model as innovative. Partner?
Yeah, we